My name is JuliAnne Murphy. I'm a best-selling author, a speaker, a communications consultant, and a recent cancer survivor, now thriver. In 2016, I was diagnosed with stage 2 breast cancer. After a year of alternative treatment out of Ecuador, which was unsuccessful, we discovered that the cancer had spread to my lungs in 12 places, and my diagnosis was upgraded, if you will, to stage 4 terminal. It was at that point in time, because my husband and I had been living in Costa Rica, that we chose to return to the United States for treatment, conventional Western treatment, including chemo and surgery. And I went through a few chemo sessions, was declared cancer-free. 11 months later, the cancer reoccurred, and at that point in time, I had a double mastectomy. It's been a very long journey. I came to death's door twice during that part of my journey as a human being, and it changed. Having cancer and traversing the cancer treatment path changed my life entirely, changed me as a person. It's based on that experience that I'm bringing you now this series called The Waiting Room, because if there's any way that I can share some of my experience and perhaps share other people's experience related to providing care for cancer in various ways, I want to do that to help make someone else's life a little bit easier during their journey. This is specifically targeted towards women. That's where my heart is, having been a woman with cancer and now being a woman that is cancer-free. I know intimately the struggles and the challenges and the way things can work and how it feels. And so it's based on all that I'm bringing you this new series called The Waiting Room. You're welcome to share this. This is something for which I'm receiving no compensation. I'm doing this out of a true desire to help other women going down this path. And you can find out more about me at juliannmurphy.com. You can see that here on the screen. I hope that this series will be helpful to you and your loved ones. And please, if it touches you, if it resonates, please share it. Thank you. This second video in the Waiting Room series is a continued interview with Dr. Courtney Carmack, chiropractor, who is going to share with us and show some specific examples of how chiropractic can be modified or adjusted for a cancer patient, specifically those maybe that have had a mastectomy, a lumpectomy, are experiencing dizziness or headaches, and or soreness in the muscles. So those are things you'll be educated on in this video, and take a look.
Chiropractors are specialists of the spine and nervous system, so although we do focus on the spinal column, that actually is not our primary focus when we are addressing that. Our main focus is a person's central nervous system. So when you look at a spine from the front and from the back, we should always see that that spine is straight. A spine from the side view actually does have to have curves. Sometimes that's new information for people. We should have one curve in the neck, one in the middle back, and then one into the lower back. So if the spine ever shifts from its normal position and does that when it misaligns, then it's putting pressure on the nervous system in that area, as well as will cause tightness or tension in the associated muscles and soft tissues in that area. Like we were previously talking about with headaches, the most common areas that I find misalignments in a person's spine with headaches is going to be right at the top of the spine at C1 and C2. These are the nerves that turn around and go back up into the head and are often to trigger headaches. Depending on where those nerves are ending up, a person with different symptoms, again, may have different areas of the spine. That's why we always assess and see where is the pressure coming from the spine. That way we know where to go, get that pressure off, get that person healing and functioning optimally. So this is a pillow that we can use depending on positioning to help make either lying on the stomach or back more comfortable for a patient, especially if they're post-surgery having any sensitivities or scar tissue. So this is a pillow that has a cutout in the middle here. That way you can lie on that without having any pressure over the chest cavity. We can also, if someone is having discomfort in their lower back with lying on their back, it can also be used when they're lying on their back as well. But then what we'd do is we'd have the person lie on this. One great thing too with these tables, these are called high-low tables. Not every chiropractor will have tables like these. Sometimes you'll just see where the tables are already down and then you'll get on them while they're down. But these are high-low, great for someone if they're having a lot of pain or having a decreased mobility, that these tables will actually lower a person into position. It goes nice and slow. And so that way, if someone is having dizziness or vertigo, that it typically is not going to trigger them to have an episode. So it goes nice and slow to get them into that prone position.
So point out, since it's just the two of us, Dr. Carmack, this is the pillow right here.
Yep.
And this basically has an indentation, which we're going to show in a moment, or have shown, that then is able to be placed there so that there's no pressure on the chest wall.
Yep.
Yeah. Okay. Is there anything else you want to point out?
Yep. And then that way it's comfortable to lie on your stomach, even if there are scars or sensitivities in the chest.
Yeah.
That day.
Okay. Cool. All right. And this is, I will say, from the patient's perspective, we're still using this for me 10 weeks past mastectomy. Super comfortable. I feel zero pressure at all. But we can still do what we need to do. Okay, so Dr. Carmack is going to indicate or show us what's called the Activator, which looks like a little bullet at the end of a stick.
Yep.
So
and it sounds like a staple gun. It doesn't put staples in the clothes, but it kind of has a clicking sound that sounds like a staple gun a little bit. This is one technique that we can use if someone is having a lot of tenderness. Maybe they also prefer non-manual adjusting. This is a great tool that we can use. That way we can address this issues in the spine without having to do manual manipulation.
And doesn't have to be just for cancer patients.
Absolutely.
People going through cancer treatment could be anybody that has sensitivity lying on the chest or even on back. You can do pretty much everything, right?
Yep.
Okay, so show us how it works.
Yep, and so it delivers a small force. And so the chiropractor would find the misalignment, put that over the misalignment, and simple as that.
That's it, yeah. And just like that, it adjusts. Well, and how exactly does it work? I mean, I've had it done many times, but from a layman's standpoint.
It delivers a small amount of force that helps to get that bone back into position, which is then going to take the pressure off the spine and nervous system for that. It's a very different type of adjustment, of course, than a manual adjusting, where so if people are used to a manual adjusting where they feel almost the instant relief, we're not necessarily going to feel that immediately with an activator. It's more subtle motion, but it's also great though if someone is having anything from a lot of pain, a lot of tenderness, personal preference, or even things like osteoporosis, or people that cannot have manual manipulation.
Okay, so very gentle. Let me just show it a little close up there of the camera just to show see what it looks like. And that's something that I've had used on me for years now, and I love it. Yep. So look if you've got it, and also great for auto injuries and things like that.
Absolutely.
Okay, let's.
And a second tool that we have in our office, this is called an arthrostim. For a lot of people, this is their favorite part about getting adjusted. It almost feels like a little massager, but also delivers a small mechanical force. There's no electricity or anything involved with that. That way we can help to restore, stimulate, and get some movement and motion into the joints again without manual manipulation. Even if someone I am doing manipulation on them or adjusting them in a more traditional chiropractic sense, a lot of times I will use this if we have a lot of tightness or restriction in muscles. If we're trying to restore range of motion, we'll also use that as well. And so this one, again, you're going to hear that sound whether we're working on a tight muscle or if we are working on restoring range of motion. Then you also may see a doctor actually work on getting that movement and motion back into the spine. But most people, again, it's not uncomfortable. It normally feels really good, and they typically don't want to stop.
It does feel like a massage, but it has that little jolt, this tiny little jolt to it, which feels really good on the muscles.
Absolutely.
Keep going.
Yes.
And so you normally do this at the end of most adjustments.
I do.
Yes? Yeah.
It's been an important tool in my practice for the last 7-8 years of how we get a lot of correction into the spine, how we help get muscles relax in a way that they wouldn't without, by just adjustment alone.
Yeah. Okay. Great. Thank you.
Yeah. So this unit is called electrical muscle stimulation, also sometimes referred to as a TENS unit. If someone has a lot of spasm or tightness in muscles or soft tissues, this would be also another therapy that we can use on them. They're little adhesive pads that you'd put over that muscle that is tight, sticks to that skin. And then again, this is using electricity. It's going to be a light electrical pulse into that to help relax that muscle.
And then that's something that you put on the patient, and then this is the system that sends those tiny little electrical impulses,
and
basically.
that usually is a therapy that we would do before the adjustment, just to help relax those soft tissues, helps the adjustment to go a little bit more smooth.
Is this something you use for every patient that comes in, or only is there a specific time that it's more relevant?
Yeah, if there is a lot of muscle spasm, or typically I like to do active exercises to warm up the spine, but if a person has a really bad muscle spasm, moving is not comfortable. And so we might do a therapy like this. That way we can get that muscle to relax without inducing or triggering the pain. So, and also it's on preference. Some people have a preference of whether they do a therapy like this to warm up, whether they do more an active exercise to warm up. So typically we'll give a patient options, but it's not something that we do on every single patient.
Okay, great.
This is another therapy that we have in our office. This is called Cervical Traction, a really great tool if someone has a lot of restriction, tightness, or tension in the neck and upper back. A lot of people will also use this instead of having the normal curve of their neck, if they have a loss of that curve. This is an exercise that will not only help those soft tissues, but help to restore that curve. A lot of times also if people have some degenerative change, an exercise like this feels really good on the spine just to help elongate and take some pressure off the spine and disc. This is also something though that we don't do for every single patient. So it would definitely be recommended by the doctor and making sure that it's safe and effective for that individual patient. But it just feels like a really good stretch of the spine. So this bar comes right around the back of the neck, and this one typically goes under the chin. If someone also has TMJ, then oftentimes we'll put it on the forehead instead of under the chin. That way we're not adding any extra stress to the TMJ. And it goes right here, and it's just a really light pull.
I'm going to back up so they can see the whole. Okay.
And so it's just a light pull and stretch.
Okay.
And it holds just for a few seconds. But a lot of people, when they have tension in doing this, they get almost immediate relief, and it just feels really good to have that stretch.
Okay, and is that something that you would ever anticipate using for someone with cancer who are going through cancer treatment?
Yeah, if they have frozen shoulder, a lot of restriction and range of motion, and exercise like this actually feels really good on their spine. So
awesome.
It may be part of their recommendations, it may not. It just depends on what is going on in their spinal column, but it definitely could be on a person's treatment plan.
Okay, cool. All right, and then let's step across the hall. I want to show this machine. I know you're not going to step on it, but I just want to show what it is.
Yep, so these are our vibration plates. So vibration has a lot of great benefits to the body when done at an appropriate amplitude and frequency for the body.
Okay.
And so whole body vibration, a couple of things we might use it for in chiropractic. One is going to be restoring posture and working on balance, but also great if someone does have a lot of lymphedema or even neuropathy in the feet. This can help to stimulate those nerve endings on the bottom of the foot, but it's also going to help lymph flow. So if someone is having lymphedema in the leg, vibration therapy is a safe and effective therapy. We wouldn't use it if someone is right after post-surgery or has any open wounds or scars that haven't healed yet. So there are some contraindications, but this also may be another therapy in the tool belt that we have for treating someone during or post-cancer treatment.
So it looks, for the most part, I just want to look at the machines. Basically, you bring somebody in and they step on this. Is that what happens?
They step, and so the further their feet are from the center, the more vibration that they'll feel. And so
Can I step on it?
Yep, it's really hard to see the words right now, but the center says walking, jogging, and running. So you're going to get more vibration the further you out. And there's many different versions of vibration plates. There'll be some that have handles, some that move differently.
Here's one with handles over here.
And a lot of these are actually designed to be used in weightlifting or for workout. So they have different attachments that you can actually do band work on with them.
So if I step on it, just to give somebody an example, and then you turn the...
Yep, and so we would set it to a level. These ones have preset programs, but you would set a speed or an amplitude that you want, and then you would just hit start.
Okay. I'm going to have to try that sometime.
And so when it does start to vibrate, then it just moves, and then that way a person just stands on in a good posture. And can help, again, a lot of great health benefits, but for cancer patients, we would mainly probably work on the lymphedema. If they have neuropathy in the feet, this would be a great.
Awesome. Great.